Hi, everyone. Thank you so much for coming to today's presentation on dementia. What does it mean? For those of you who don't know me, my name is Kristen Fleming, and I am the Regional Training and Education Coordinator for the Alzheimer's Disease Caregiver Support Initiative. We have a grant from the New York State Department of Health to provide services for caregivers of anyone with any form of memory loss or dementia. And we cover 6 counties. They are Clinton, Franklin, Essex, Warren, Washington, and Hamilton counties. Although the wonderful thing about virtual programming is that people can attend from all over the world if they want to, and we're happy to spread more information about dementia. Let me just tell you a little bit more about the other services that we offer. So we do offer education and training. Right now, all of our programming is happening virtually. So I'm doing webinars. We also have guest speakers at our caregiver conferences, and we will be doing those again this year virtually. We do support groups. Again, those are all happening either on Zoom or on the phone, where caregivers can connect with each other, share strategies, things that are working well, things that they're having trouble with, and get some tips from other people. We do something called a memory cafe, which is really fun. These are social events for caregivers and the people with dementia. So each month, we're doing them monthly on Thursdays at 2:00, and we are doing different crafts. So I will deliver all of the supplies you need to do the craft, and then we get on Zoom together and do it all at the same time. It's a really great way to socialize while we're still staying safe at home. Let's see, what else do we do? We have care consultations. So you would meet with one of our care navigators, and they would talk to you about your current situation, share some of the resources that our program has to offer, as well as other programs in the area, and they can help connect you to a lot of good community resources. We offer respite. So if you are the primary caregiver and you have to care for your loved one 24/7, we will pay for you to get an occasional break. It's not meant to be full-time caregiving, but it is an occasional break, so that you can get away, go to your own appointments, go to the gym, go for a walk, take a yoga class, take a nap, whatever it is that you need to do so you can get a little bit of a break. And lastly, we offer something called Project Lifesaver. So one thing that a lot of caregivers struggle with is their loved ones wandering. So if your loved one is able to wander, sometimes even the most diligent caregivers, they have to go to the bathroom sometimes, they have to sleep at night. So let's say you wake up in the middle of the night and you don't know where your loved one is, or you come out from the shower and you don't know where they've gone to. Well, this is a bracelet that they would wear, and you look around, you check the backyard, you check the neighborhood. 10 or 15 minutes go by, you still can't find them, especially in the wintertime when it's cold out. It can be very, very worrying. So you would actually contact the sheriff's department, and they have a wand that they use, and they wave, and it goes with radio frequency waves so that they're able to locate your loved one. It's very old school technology. It's not GPS, but it is very, very reliable, and it has a very high success rate. It's also a nationwide program, which is great. So if you're on vacation in Florida, you could call the sheriff's department down there and they would be able to help you locate your loved one too. So that is a little bit about me and our program. And today we're going to be talking about dementia. What does it mean? So some of the different types of dementia, and the difference between dementia and normal aging. Like I said before, you are in a listen-only mode. So if you have any questions, feel free to type them into the chat box or the Q&A, and I will be happy to answer them. I already see a question. Are there risk factors like sleep deprivation, artificial sweeteners, medications, and dehydration that can add to your chances of getting dementia? And yes, there are. We'll talk about this a little bit in my presentation, but that's a great question. And a lot of times people think that it's only hereditary, that if their grandparent or if their parents or other family members had dementia, then they're definitely going to get it. But that is not necessarily true. According to the World Health Organization, there are certain things you can do to lower your risk of developing dementia. Now, are there people who avoid these things and still get it? Yes, but it does lower your risk. So these things are exercising regularly, eating healthy, getting a good night's sleep, quitting smoking, really just living a healthy lifestyle will help you prevent getting dementia. So before we get into my PowerPoint, is this gonna go? There we go. I do have a video that I want to show you first. It's just a short couple-minute video. It goes over the difference between Alzheimer's disease and dementia. So we'll start that now.
What's the difference between Alzheimer's disease and dementia? Perhaps you've been confused by these terms in the past, or mistakenly thought they were the same thing. Well, you wouldn't be alone, because knowing the difference between Alzheimer's disease and dementia can be tricky. But it's actually not too hard to understand. In a nutshell, it's like the difference between shortness of breath and asthma. Shortness of breath is not a specific disease. It can have many different causes, and asthma is just one of them. Likewise, dementia is not one specific disease. It's a combination of symptoms that has many different causes, including Alzheimer's disease. Still sound a bit confusing? Okay, think of it like this. You go to your doctor with shortness of breath. To find the cause, she listens to your chest to see if it's due to asthma or pneumonia. And then she checks your heart to see if your breathlessness is caused by heart failure or a very rapid heartbeat. She even asks if you've been worried in case your breathing difficulty is anxiety related. After her examinations, she concludes that your shortness of breath is actually a nut allergy. Similarly, when dealing with dementia, your doctor needs to figure out the underlying cause. And while Alzheimer's disease is the most common cause of dementia, it's not the only one. Dementia can also be caused by vascular changes in the brain, Parkinson's disease, Lewy body disease, vitamin deficiencies, thyroid gland problems, chronic brain infections, or medications. Even a very deep depression can sometimes look like dementia, which means if someone you love has dementia, it doesn't necessarily mean that they have Alzheimer's disease. And that's very important for your doctor to establish, because some causes of dementia, such as infection, medication reactions, an underactive thyroid gland, or vitamin deficiencies, can be reversible with the right treatment. So figuring out the cause and a plan of action could improve your quality of life. And that's why, if you or your loved one have the symptoms of dementia, you need to see your doctor to find out the underlying cause.
So I really like that video because I think it does a pretty good job of showing the difference between Alzheimer's disease and dementia. That's one of the biggest questions that I get asked. And what I usually like to tell people is that dementia is actually an umbrella term. So if you think about cancer too is another umbrella term that everyone's very familiar with. It's a medical condition, and there are many different types of cancer. You could have lung cancer, you could have a brain tumor, you could have leukemia. There's many different types. It's the same thing with dementia. So if you have dementia up at the top of the umbrella, there's Alzheimer's disease, which is one type of dementia, but there's also vascular dementia, Parkinson's, Lewy body dementia, frontal temporal dementia. Those are the most common types. And in general, what all of these forms of dementia have in common is the loss of thinking, remembering, and reasoning or cognitive functioning. There also has to be a decline in behavioral abilities that affects a person's daily life. So everybody, this is another question I get asked, everybody loses neurons as they age in their brain. However, people with dementia lose these at a much faster rate. And dementia is very common as people get older. That's the number one risk factor for developing dementia is being 65 years or older. However, it's not a normal part of aging. So not everyone is going to develop dementia. It's not normal. It's common, but it's not normal. And so in order for a person to be diagnosed with dementia, they have to have 2 or more core mental functions impaired. So this could be their memory, their language, visual perception, or even the ability to focus and pay attention. And a person also must have loss of brain function that prevents them from doing everyday tasks. Things like showering, cooking and eating, getting from one place to another. And the causes and symptoms of dementia can vary depending on the form of dementia that a person has. Now, the video did a really good job of explaining this too. So there are medical conditions that can cause memory loss that are treatable. These are things like normal pressure hydrocephalus, which is the buildup of fluid in the brain, side effects from medication, depression, some vitamin deficiencies, drinking too much alcohol, having a brain tumor, head injuries. Football players, a lot of the time, if they have too many concussions, they might develop dementia. That's a risk factor. And thyroid, kidney, or liver problems. But all of those are treatable. So for example, I have a thyroid condition. I have an underactive thyroid. And before it was diagnosed, sometimes I would have a little bit of brain fog. I would have a hard time remembering things. But now I've been diagnosed, take my medication, I get my levels checked every few months to make sure I'm still on the right dose, and I don't have any memory problems. On the other hand, there are what's called neurodegenerative disorders. So that's the Alzheimer's disease, the frontotemporal dementia, the Lewy body dementia, vascular dementia, or mixed dementia, which is actually having more than one type of dementia. And these disorders, there are no cure. They cause a progressive, irreversible decline in thinking and memory and behavioral abilities. And medication can help slow the disease for some, like Alzheimer's disease. However, it will not stop the disease entirely, and it won't help the person get back any of the memory or their abilities that they've lost. So a lot of people will ask, well, you said dementia isn't a normal part of aging. What is the difference? So everyone forgets things every once in a while. I forget things all the time. You walk into the kitchen and you're like, oh, what did I come in here for? Or let's say you go to leave and you can't find your car keys. You didn't put them where you normally do, and now you don't know where they are. That's normal. But when someone has dementia, these things start to happen more and more frequently. And sometimes they don't even remember what they've forgotten, if that makes sense. So I remember when my memory fails me, and I can look back and say, oh yeah, I couldn't find my keys because I didn't put them on the hook, or I didn't put them in my purse. Well, a person with dementia might not even remember that they forgot something. Decreased lack of focus, lack of motivation, or decreased memory does not always mean you have dementia. These could be signs of depression, of another medical issue, or even normal aging. But with normal aging, you want to look at the rate of the decline too. So people with dementia tend to decline much, much faster, whereas with normal aging, it's kind of a slow, gradual totally blanking. Slow, gradual change. That's the word I was looking for. Slow and gradual change. Speech skills. We all forget a word here or there. That's normal. But having frequent pauses in speech, calling things by the wrong name, or having a hard time understanding speech, having a hard time holding a conversation, that could be a sign of dementia. Memory loss, like I said, People can usually remember times where their memory has failed them, and they're frustrated by it. They're like, oh, I can't believe I saw that girl in the store and I couldn't remember her name. With dementia, you might not even remember that you've forgotten something, or they won't acknowledge it unless they're asked about it. Short-term memory loss is not a normal part of aging. So if you can't remember recent conversations or recent events, that is not a normal part of aging, but it's very, very common with dementia. And having trouble with familiar tasks. So it's normal to have a hard time learning a new skill. So if you're trying to learn a new language or do a new recipe or something like that, that's normal to have trouble with that. However, if you have a hard time remembering how to make your family recipe that you make every year, or if you get lost in your neighborhood when you've lived there for the past 20, 30, 40 years, that's not a normal sign of aging. Losing social skills is also not a normal sign of aging. So sometimes with dementia, you might see a decreased interest in socializing, the inability to have a conversation, having trouble speaking with others, or an increase in socially inappropriate behaviors. Maybe they're being very flirtatious, or they're blurting out dirty words or jokes. That's not a normal sign of aging, but it can be a symptom of dementia. And the signs and symptoms of dementia can vary depending on the person, the type of dementia, what stage they're at. So it really varies from person to person. That's something to keep in mind. On the other hand, some common aging symptoms. So it's very common to have a slower recall speed. It takes you longer to think of the word you're looking for, the name you're looking for. Having a decreased problem-solving abilities is also very common. Slower reaction time, decreased attention span, decreased concentration, decreased learning speed. All of those things are common aging symptoms. So that's not something you need to worry about. Now, let's say you start to wonder, maybe I'm noticing some memory changes in myself or in my loved one, my mom or my husband, their memory isn't what it used to be. So how is dementia diagnosed? Well, usually you're going to start by talking to your primary care physician, and they're going to look to see if there is another cause, such as depression, vitamin deficiency, hydrocephalus. They want to rule out those reversible dementias that we talked about earlier, and that's one of the reasons why early diagnosis is so important. So they're going to do a regular physical exam, everything that you normally see when you go to the doctor. They'll ask your medical history as well as your family history. Especially if there's anyone with dementia in the family. And they'll want to know when you first noticed the symptoms start, as well as if there have been any behavior or personality changes. They'll go over medications you're currently taking to help rule those out as a possibility as well. They'll check your blood pressure to help rule out other conditions that might be causing the dementia that could be treatable. And then they might do a neurological test. They'll look at things like your balance, your reflexes, your eye movements, and sensory functions. After they've done those things, they'll move on to like a cognitive or what's called a neuropsychological test. And these are simple pen and paper tests. They'll ask you a series of questions. They might ask you to draw like a clock or pictures. They'll test your problem-solving abilities, your attention, your language, and other skills regarding your mental functioning. They'll do lab tests like a blood or a urine test to rule out other possibilities. They might choose to do a brain scan to see what's going on, if they can notice damage to certain areas of the brain. So they might do a CT scan or an MRI or a PET scan. They'll do a psychiatric evaluation to help rule out depression or other mental health conditions. And some forms of dementia are caused by genetic defect. So in families where dementia is common, they might choose to do a genetic test to see if you're at a higher risk for developing dementia. However, if you do have the gene marker that says you're at a higher risk, you might not develop it. So it's kind of hard to say. Now, Alzheimer's disease is the most common type of dementia. So I have another short video that's on Alzheimer's disease. I'm going to play for you now.
What is Alzheimer's disease? Alzheimer's is a slow, fatal disease of the brain affecting 1 in 10 people over the age of 65. No one is immune. The disease comes on gradually as 2 abnormal protein fragments called plaques and tangles accumulate in the brain and kill brain cells. They start here in the hippocampus, the part of the brain where memories are first formed. Over many years' time, the plaques and tangles slowly destroy the hippocampus, and it becomes harder and harder to form new memories. Simple recollections from a few hours or days ago that the rest of us might take for granted are just not there. After that, more plaques and tangles spread into different regions of the brain, killing cells and compromising function wherever they go. This spreading around is what causes the different stages of Alzheimer's. From the hippocampus, the disease spreads here to the region of the brain where language is processed. When that happens, it gets tougher and tougher to find the right word. Next, the disease creeps toward the front of the brain, where logical thought takes place. Very gradually, a person begins to lose the ability to solve problems, grasp concepts, and make plans. Next, the plaques and tangles invade the part of the brain where emotions are regulated. When this happens, the patient gradually loses control over moods and feelings. After that, the disease moves to where the brain makes sense of things it sees, hears, and smells. In this stage, Alzheimer's wreaks havoc on a person's senses and can spark hallucinations. Eventually, the plaques and tangles erase a person's oldest and most precious memories, which are stored here in the back of the brain. Near the end, the disease compromises a person's balance and coordination. And in the very last stage, it destroys the part of the brain that regulates breathing and the heart. The progression from mild forgetting to death is slow and steady, and takes place over an average of 8 to 10 years. It is relentless and, for now, incurable. Helping your family, friends, and neighbors to better understand Alzheimer's will reduce stigma, improve care, and even help the fight for a cure. Thanks for helping to do your part. Learn more at www.aboutalz.org.
So, like in the video, you see that Alzheimer's disease is the most common dementia found among older adults. It's a progressive, irreversible brain disorder that destroys a person's memory and thinking skills. Most people show their symptoms in their 60s, and this is called late onset. However, symptoms can occur as early as a person's 30s, and this is called early onset, but it's very rare. Alzheimer's is caused by the buildup of plaque and tangles in the brain, which if you think about it, like plaque will build up on your teeth, it can build up on your heart, also can build up on the brain, and that makes it more and more difficult for the neurons and nerve cells to connect. And these messages, the messages that get sent to different parts of the body and to different areas of the brain misfire. Estimated that more than 5 million Americans today have Alzheimer's disease, and it's expected that that number will grow as the baby boomer generation continues to age, unless a cure or a treatment is found. The amount of time a person can live with Alzheimer's disease varies from person to person. For some, it's as little as 3 to 4 years. However, for others, it might be 10 or even more years. There we go. So what do they think causes it? Well, it's a variety of factors. Age is the number one risk factor for developing Alzheimer's disease. 1 in 10 people over the age of 65 have Alzheimer's disease. And once a person reaches 85, the odds jump up to 1 in 3. Scientists believe that when it comes to late onset Alzheimer's disease, genes, lifestyle, and environment all play a part in developing the disease. So with the genes with late set Alzheimer's disease, there might be a link between a specific gene on one of the chromosomes that seems to increase a person's risk of developing it. However, having this gene does not mean the person's definitely going to get Alzheimer's. As there are some people who have it and they never get Alzheimer's, and others who don't have the gene and do end up having it. So that's why they think it's not just genetics, but it's also lifestyle, health, environment. In some early onset cases, there's a mutation to one of 3 genes. It's called early onset familial Alzheimer's disease. And if a person carries that specific genetic mutation, then they have a 50-50 chance of having the mutation themselves. So if they do inherit the gene, then they're more than likely going to develop early onset dementia. It also is believed that there are connections between Alzheimer's disease and vascular conditions like heart disease, stroke, and high blood pressure, as well as Alzheimer's disease and diabetes and obesity. So there is, like I've said before, there is no treatment, there's no cure, there's no cure, but there are some medications and interventions that can help with some of the symptoms of Alzheimer's disease. Medications tend to work best for people who are in the early to moderate stages of Alzheimer's disease. And it's important to remember that the medication is not going to stop the disease from progressing. However, it can slow some of the symptoms down, which can allow the person to live longer or help the caregiver with managing some of the symptoms. It might make them a little more independent. When doctors start a person on Alzheimer's on a medication, they'll start them at a low dosage usually to see how the person reacts. And then they'll slowly start to increase the dosage based on how the person does. The higher the dose, the more likely there is to be side effects. So as with any medication, you want to keep your doctor informed if there are any side effects from the medication or any changes to medication, such as taking a different over-the-counter medication. The biggest thing and the most important thing is to manage the person's behaviors. So some behaviors can be managed through medication. However, it could also be beneficial to both the person with dementia and the caregiver to try to manage the behavior in other ways before you put them on medication. So for example, in the video, they said one of the things you might see is hallucinations. Well, if your loved one is having hallucinations, I often say your approach depends on the type of hallucination they're having. So a lot of times these hallucinations will involve kids or pets or animals. So if they're hallucinating that the neighbor's cat came over and was just kind of sitting on the couch with them, they were having a good time with the cat, or the grandkids came over and they baked cookies together and played on the piano together, there's no harm if they're positive hallucinations. There's no harm in pretending and going along with it and saying, oh, that's wonderful that the cat came to visit or the grandkids came to visit. It's wonderful. However, if the hallucinations are more sinister, like someone's out to get them, or wild animals running around the house so they can't sleep, there are chipmunks running around the house, they can't sleep at night, or someone's going to break into the house, something like that, and they're feeling scared or worried, well, then you want to intervene to make sure the person feels safe. Same with other, like something that's really common is for them to not remember when loved ones have passed away. So maybe they want to go visit their parent who maybe passed away. Well, instead of saying, well, don't you remember your mom died 20 years ago, where they're going to have to relive that grief again. Instead, you could say, oh, well, she's out at church, or she's out with visiting her sister or something like that, and then distract them and redirect them. I think it's the more compassionate thing to do rather than have them relive that grief, to just go along with whatever they're saying. Because one thing that's really hard for caregivers to understand is you need to join their reality. You're not going to be able to convince them of something otherwise. So join their world, join their reality, and try to make it as positive as you can. Now, vascular dementia is another type of dementia. It's actually very similar to Alzheimer's disease. This is my last video that I'm going to show you here.
What is vascular dementia? Vascular dementia is the second most common type of dementia. It is caused by problems with the blood supply to the brain. Nerve cells require oxygen and nutrients to survive. Without them, they will become damaged or die. Cells are provided with oxygen and nutrients by a network of blood vessels in the brain. When the blood supply to the brain is interrupted, for example by a sudden blockage or a leak, this is called a stroke. A stroke can cause significant damage to parts of the brain. When the parts of the brain responsible for memory, thinking, or language are damaged in this way, a person will have difficulty remembering things, thinking, or speaking. These are all symptoms of vascular dementia. Sometimes, a single large stroke is enough to cause the symptoms of dementia. This is known as post-stroke dementia. This scan shows damage to the brain of someone with post-stroke dementia. In other cases, a person may experience a series of smaller strokes that gradually cause damage. This is known as multi-infarct dementia. Following a stroke, a person's symptoms may remain constant for a while. Then, if the person has another stroke, they may notice a sudden worsening of symptoms. This is known as a step-like progression. Small vessel disease is where there is a narrowing of the blood vessels deep in the brain. Small vessel disease is the most common cause of vascular dementia. As the narrowing affects more small blood vessels and more of the brain becomes damaged, the person will experience a gradual loss of abilities. Usually, people with small vessel disease notice a slowing of thinking and problem solving. For example, taking longer to think of a word and write it down. Evidence suggests that lifestyle factors that promote a healthy blood supply, such as regular exercise, not smoking, and eating a healthy diet, could help to reduce the risk of vascular dementia. There is currently no cure for vascular dementia. However, by controlling underlying cardiovascular diseases which affect the blood supply, such as high blood pressure, high cholesterol, and heart disease, it may be possible to slow down the progression of the condition. Vascular dementia will affect people differently, depending on the parts of the brain that are affected. However, a common symptom is having problems with planning and organizing, or with concentrating. It can help to break complex tasks down into smaller steps, and to make sure that environments are not too busy or noisy.
So vascular dementia is the second most common form of dementia, and researchers actually do believe that vascular dementia is often underdiagnosed. Like in the video, you see the vascular dementia usually occurs when the blood vessels to the brain are damaged or blocked, depriving the brain of nutrients and oxygen. It can be caused by a stroke, where if the stroke is large, the symptoms might be noticeable right away. However, you could also have several mini strokes, and in that case, their changes in their memory and their thinking is likely to be more gradual. And changes in the brain areas that are responsible for storing and retrieving information can cause memory loss that makes vascular dementia look a lot like Alzheimer's disease. Vascular dementia often exists with other forms of dementia, such as Alzheimer's and Lewy body dementia. Because it depends on what part of the brain is affected by the blood vessel damage, the symptoms of vascular dementia can really vary. The change in memory may or may not be significant. Usually, the symptoms are noticeable right after the stroke, and the symptoms of vascular dementia could occur at the same time as the well-known stroke symptoms like headache, difficulty walking, numbness, or paralysis on one side of the body. When there are many strokes, the symptoms may not be noticeable right away, and there could be a more gradual change in thinking and in memory. So with the major stroke, a lot of times we see confusion, disorientation, trouble speaking and understanding, and vision loss. Whereas with the multiple mini strokes, we see over time poor planning and judgment, uncontrolled laughing or crying, often in inappropriate situations, decreased attention span, decreased functioning in social situations, and difficulty finding the right words when they're talking. A lot of times, vascular dementia is just treated with the medication to help prevent strokes. The thought behind this is you want to minimize the risk of stroke, so you minimize the amount of brain damage that occurs. However, there are medications to help some of the other risk factors, and there are some studies that indicate medications that are used for Alzheimer's disease could also help with memory at the beginning stages of vascular dementia. You really want to manage your other risk factors too, like high blood pressure, high cholesterol, diabetes, and weight to help prevent more strokes from happening. Excuse me. Okay, so dementia with Lewy bodies. This is another type of dementia. It's caused by abnormal protein deposits in the brain. They're called Lewy bodies. They affect the chemicals in the brain that can lead to problems with thinking, behavior, movement, and mood. It's a progressive form of dementia where the average time from diagnosis to death is 5 to 7 years. And the rate at which symptoms begin to develop varies depending on overall health, age, and the severity of symptoms. There are two forms of Lewy body dementia, Lewy bodies with dementia and Parkinson's disease with dementia. So this is often associated with Parkinson's disease. And at the beginning, these could look like two separate diseases. However, as they progress, they could have very similar symptoms. During the early stages of Lewy body dementia, a person can live a fairly normal life. However, as the disease progresses, the person with Lewy body dementia will require more help due to the decline in movement and thinking. And in the late stages, the person will depend entirely on others for care. Treatment for the symptoms may work for a while. However, there is no cure at this time. One of the most common symptoms of Lewy body dementia is hallucinations. We see that a lot, especially in the early stages, whereas with Alzheimer's disease, there are hallucinations that can happen, but they don't usually happen until the middle to late stages. They could also have trouble with visual perception, planning, problem solving, and reasoning. Cognitive fluctuations, so the person doesn't seem to have the same concentration from day to day or even at different times of the day. They could seem very lethargic or sleepy, even if they got plenty of rest the night before. The person may have difficulty with their thoughts where they come out unclear. Movement, so one early symptom of movement could be changes in their handwriting. That's very common in the early stages, and that tends to be overlooked. They might also have muscle stiffness, shuffling walk, shaking or tremor, balance problems, a stooped posture, loss of coordination, reduced facial expression, difficulty swallowing, and a weak voice. Sleep disorders are also very, very common with with Lewy body dementia, but they often go undiagnosed. Sometimes going to see a sleep specialist can be very helpful for getting diagnosis and treatment. most common thing that happens is something called REM sleep disorder. This is when a person is acting out their dreams. It could be talking in their sleep, violent movements, even falling out of bed. And this could occur in a person for years, even before the other Lewy body symptoms occur. A lot of times it's only noticed by the person's spouse. Excessive daytime sleepiness is another common symptom of Lewy body dementia. This is when a person's sleeping for more than 2 hours during the day. Insomnia, difficulty falling and staying asleep, and restless leg syndrome. Like, this is when a person usually resting has the urge to move their legs in order to stop unpleasant or unusual feelings in their legs. Behavioral and mood symptoms are also common, so they could experience depression, apathy, just a lack of interest in their normal daily activities, anxiety, agitation, delusions, where a person strongly believes or has an opinion that's not based in evidence, and paranoia, an irrational distrust of people. The exact cause of Lewy body dementia is still unknown. However, there are a few things that most researchers believe to be risk factors. So age, most people who have Lewy body dementia are over the age of 50. So it's a little bit younger than Alzheimer's disease. Diseases and other health conditions that are associated with Lewy body dementia are Parkinson's disease and REM sleep disorder. Both of those put the person at a higher risk of developing Lewy body dementia. Genetics, Lewy body isn't considered a genetic disease. However, it might increase a person's risk factor if he or she has a family member with the disease. And lifestyle, there's no one piece of a person's lifestyle that seems to increase the chances of forming the disease. However, researchers do believe that having a healthy lifestyle can reduce the chances. One fun fact about Lewy body dementia is actually that Robin Williams had Lewy body dementia, which is very interesting. So treatment and management. Since it can't be cured, just like the other forms of dementia, there are some treatments, however, that the symptoms will respond to, but it's usually only in the early stages. For any of the forms of dementia too, building a care team can be very beneficial to both the person with Lewy body dementia and the caregivers. A care team should include the neurologist who specializes in dementia, physical therapists, speech therapists, occupational therapists, mental health counselors, even look into music and expressive arts therapists. Support groups can also be very beneficial to the patient and the caregivers. They can talk to others who are in a similar situation. Sometimes medications that are used for Alzheimer's disease can be effective in people with Lewy body dementia. These could be used for some of the cognitive symptoms of Lewy bodies. The movement symptoms of Lewy bodies can sometimes be treated with Parkinson's medications. However, if the movement is mild, sometimes it's best not to treat it at all, as there are some potential side effects. Since the lack of sleep can increase the confusion and behavioral problems a person with Lewy body dementia may have, it's important to make sure they get the best night's sleep possible. Problems with sleep can be treated with medication. However, sometimes increasing or changing the person's activities during the day can help greatly with the quality of sleep. And a doctor may order a sleep study to evaluate what the cause of the sleep disturbance is and the best course of treatment. One of the hardest things for caregivers of a person with Lewy body dementia to deal with is the hallucinations and the delusions. While these can be managed through medication, it's important to think of if the hallucinations or delusions are hurting anyone or how much distress they're causing the person. The person may not understand that the hallucinations are not real and they can be more anxious or scared. Caregivers can help by acknowledging the person's fear that they may be having and offering empathy. The behavioral problems may not just be from hallucinations. The person could be experiencing pain or illness, or maybe they're unable to express how they're feeling. So you want to figure out what's causing the behavior. Antidepressants can be well tolerated by people with Lewy body dementia. However, some other antipsychotic medications should be used with caution, as these can have severe side effects and actually make movement issues worse. Now, frontotemporal dementia, this is the last form of dementia we're going to talk about today. what is it? So it is a type of dementia that actually affects the frontal and temporal lobe. So that's right here by your forehead and over above your ears and your temples. And that part of the brain is what is really responsible for all of your filter. It's what keeps you from blurting out whatever you want to say. So people with this form of dementia, they have no filter. They're going to do or say whatever will make them feel the most comfortable. So let's say it's a really hot day out, they might just take their shirt off in public because they want to cool down. It's hot out. They have no thought for modesty. Or if someone's really annoying them, maybe they're going to blurt out a swear word or call them a not very nice name with no thought to offending them. So this form of dementia, again, is a progressive form of dementia. It actually tends to affect younger people who are about the age 45 to 64. And there's no cure. The life expectancy is about 10 years. So the symptoms can vary widely from person to person. Behavioral symptoms would include problems with planning and remembering which step comes first, next, then having trouble prioritizing, compulsive eating or doing an activity or saying the same word over and over again, or having difficulty resisting the impulse to use or touch things when they see them. So maybe they see someone who has really nice long hair and they just go over and touch them without really thinking about, oh, that's someone else's personal space. We shouldn't be just touching strangers at the store. Or taking a pen and paper from the table. They walk into someone's office and they just pick up the pen and paper, even though they have no intention of writing with it. Or they might laugh in a meeting when it's really inappropriate or start to make loud noises. They just have no thought to their behavior and its effects on other people around them. Language symptoms may include having difficulty understanding or using words, but they can physically say them, or they understand the word, but they have trouble saying them. For example, slurring their speech. Emotional, so their emotions could be disconnected from the situation or expressed at the wrong time, like laughing at a sad situation. They might have difficulty reading social cues from people around them, or they might lack the ability to understand how other people are feeling and really empathize with them. Movement symptoms are also common. They could walk with a shuffle, become clumsy, have tremors, usually starting in the hands, and have strange postures with their body parts. So they might have trouble with common actions such as using a knife and a fork or writing. Researchers are unsure what the cause is for frontotemporal dementia. Unlike other forms of dementia, age isn't one of the risk factors since it tends to affect people who are under the age of 65. However, they believe it's caused by a lack of neurons and plaque buildup in those areas of the brain, causing damage or shrinkage to those lobes. The damage can start in either region first, and then it will move to the other part of the brain. And frontotemporal dementia is more likely to run in families compared to other forms of dementia. So currently, just like with all the other forms of dementia, there's no cure for frontotemporal dementia. So one of the things to do is to make things easier for the patient and the caregiver is to manage the symptoms. So behavior management can be difficult for the caregiver because they need to accept instead of challenging the person with frontotemporal dementia. This means not arguing or trying to reason with the person. They really are unable to control their behaviors and cannot see that what they're doing is upsetting to others. So having a routine in place can be helpful. It can keep things less confusing and lead to better sleep. Giving two choices when asking a person what they would like is a lot easier than an open-ended one. So if you're going out to eat, you could say, oh, do you want the chicken or the fish? Medications can be used to help with some of these behaviors as well, but you want to be careful of the side effects. Language can decline over time. So it's important to maintain the language that's already there and find other ways to communicate when speaking isn't possible. Sometimes people will still be able to write even if they can't talk. So you could write to them, or when someone is struggling with the language, it's helpful to slow down and speak clearly. Sometimes working with a speech and language pathologist can help determine the best tools to use. And physical and occupational therapy can be helpful with movement symptoms due to frontotemporal dementia. In some cases, medication that's used for Parkinson's disease can be helpful. However, no treatment can slow down or stop movement disorders that are caused by the frontotemporal dementia. So mixed dementia is when a person has two or more forms of dementia. There are some studies that show that this is actually the most common form of dementia in elderly. It seems to be that people will either have Alzheimer's disease and vascular dementia, that's very common, or there will also be Alzheimer's disease and Lewy body dementia. A study found that in 40% of autopsies done on a person who was thought just to have Alzheimer's disease, they also found signs of stroke or vascular disease. And the risk factors for vascular dementia and Alzheimer's disease tend to be the same. It's unclear now if a person whose brain shows symptoms of multiple dementias will suffer from worse symptoms. They're still researching that. And I'm sure what everyone is wondering is, how can I lower my risk? And this brings us back to the first question. There are a lot of lifestyle factors that can increase your risk for developing dementia. So you want to quit smoking if you are a smoker, manage your blood pressure, your cholesterol, your blood sugar, eating a healthy, balanced diet, exercise, maintain a healthy weight, limit alcohol, and protect your head from injury. Again, aging is the biggest risk factor for dementia. However, there are things we can all do to help lower our risk for developing it. So that brings me to the end of my presentation. If anybody has any questions, feel free to ask them now, or either type them into the Q&A box or the chat box. And while I'm waiting to see if there are any questions, I do have a couple of housekeeping things I want to let you know about. So first of all, I used to do all of these presentations in person, and I would bring folders with packets of information. I usually would bring a book that goes along with it. So if you were interested and you were local, I can either drop that book off to you and the packet with information. If you live further away, I'm happy to mail that to you. So just let me know in the Q&A box if that's something that you're interested in. I also want to let you know about some of my upcoming events. So every Wednesday from 10 a.m. to 11 a.m., I'm doing something called Coffee Chats about senior health. So each week we're talking about a different topic related to senior health, and we'll have guest speakers on some weeks. So if that is something you're interested in, it's virtual, you're welcome to attend. Just let me know and I'll send you the email. We're continuing to offer support groups. So we have support groups, we have memory cafes, and I have another webinar. So next week at the same time, 1 o'clock on Monday, we are going to be talking about just diagnosed, what's next. So there's a question in the chat box. Are there doctors in the North Country who specialize in diagnosing causes of dementias? So that's a great question. The doctors that I am familiar with, I know you can go to UVM in Vermont and to get a more specific diagnosis, or you can go to the CAD, which is in Glens Falls Hospital. And that's the Center for Excellence in Alzheimer's Disease Care. So those are the two places that are the closest to us in the North Country to go. It would be UVM in Burlington or the CAD in Glens Falls. Unfortunately, there isn't anyone more locally that I'm aware of. But great question. Are there any other questions? just another minute. So next week, I'll send out an email to everyone who attended today. If you are interested, there will be another presentation called Just Diagnosed What's Next next week, same time, Monday at 1 p.m. And like I said before, if you would like the book or other resources, let me know. I'm happy to either drop that off to you or mail it to you, depending on where you live. Excuse me. Well, if there are no other questions, I want to thank you all for attending my presentation today. I hope you enjoyed it. I did record this presentation, and I've recorded all of my previous presentations. They are on our website, which is wehelpcaregivers.com. So if that is something you're interested in, or you missed one that you want to see, feel free to look on our website to find that information. Otherwise, I hope to see you all at one of our events soon. Thank you, everyone. Take care. Bye-bye.